A lot of people don't actually know the different pathways that exist for them to have full license or at least partial license to practice in Canada. This is still really a mystery till today. And in this video, I'm going to break down the different pathways to become a physician in Canada. I've seen people who reach out to me through this forum and through other platforms telling me that they never knew that there was a pathway for them. And because they wasted so much time, they missed meeting certain requirements just because they wasted time and they're out of the window that they were expected to meet that criteria to be able to practice. And they should have been able to get full license to be able to practice. I want you to think about this. Start prepping yourself from your home country as you prepare for your permanent resident and as you work your way to getting your PR. So that once you reach Canada as a physician, you get integrated right into the workforce and you don't have to linger around driving an Uber or doing some clinical research job for someone who is just about to get a bachelor's degree. So if you're new on this platform, welcome. I am an internal medicine resident at University of Calgary, and for you to support us, please hit subscribe, and thank you so much. Let's dive right into it on how you can become a physician in Canada, starting from your home country. But I'm going to give you an overall general picture how anyone can become a physician in Canada. Did you know that there are 9 different ways in which anyone can become a physician in Canada? Now, I'm going to go from the very basics. For people who are born here in Canada, you are called a CMG or Canadian Medical Graduate. And you become a physician by going through medical school here. So you get your bachelor's degree and then you go to medical school. And after medical school, you get into residency by applying through CaRMS. And then after you become a physician and you can practice independently. Most universities in Canada make master, and University of Calgary, where the medical school is 3 years, whereas all the other programs, 4 years of medical school. So you get a bachelor's degree, then you do 4 years of medical school, then you get into residency after matching through CaRMS, and you get to do about between 2 to 7 or 8 years of residency, depending on what specialty you get in. And then you work independently. That's pathway number 1 for those who are born in Canada, grow in Canada, and do medical school in Canada. Pathway number 2 is for international medical graduate or foreign trained medical graduates. And this path is usually for IMGs who come from universities all across the world, and that those universities are recognized by WHO or the World Directories for Medical Education, so the WORDA. And for you to qualify, what you need to do is clear boards exam. So you need to pass the MCCQE1, you need to pass the NACOSKI, and then depending on what subspecialty you're going to be applying to, if you're applying to family medicine, you need an additional exam called the FM Pro C exam, which you have to clear. And then depending on what province you're applying to, you might need other exams or tests like CASPER test in order to make it. If you don't know anything about this, we have done videos, check in the description and you will see, or you send us an email, we'll be able to send you some information about these different exams. And then you would enter and pursue residency similarly as Canadian medical graduates, ranging between 2 to 8 years based on the specialty that you get into. One caveat to this though is that usually IMGs don't have the same number of spots that are allocated to get into residency compared to Canadian medical graduates. And over the years, we've seen that thousands apply, and historically, the numbers are increasing, but we've always had about somewhere between 300 to 450, maybe might go up a little bit to 500 with the increased population growth in Canada of foreign trained medical graduates who end up matching in CaRMS after the first and second iterations. And after you're done with residency, you also have your full independent license. So that is pathway number 2. Now, pathway number 3 would be the Practice Ready Assessment or PRA. And this pathway is for foreign trained physicians who had, to a certain degree, already had some independent practice back home. This path usually has limited spots. We've done a video on it. You can check on our channel and you will see that. But this pathway usually has limited spots for internationally trained physicians. And usually people from countries like the UK, Australia, New Zealand, the US who can do a direct equivalence can bypass certain exams that they need to clear. But someone going through the Practice Ready Assessment pathway usually needs to take the TDM or the therapeutic decision-making exams. And this exam is quite important because you need to be able to pass it to show that you're up to date and current with clinical knowledge. Then you would usually work under a preceptor who is going to be some sort of your mentor and approve of what you're doing. Now, this can vary depending on what you're coming into. Different colleges of physicians and surgeons have different requirements on what province you're intending to work for. And so you need to check with the College of Physicians. So there's two big pathways. There is those that are getting into family medicine, and then those that are getting into other subspecialties. Now, for those getting into other subspecialties, your time that you work under supervised practice is longer than for those who are getting into family practice. In family practice review assessment has been around for a while, and we've done multiple videos on. There are other provinces like British Columbia who no longer require you to even pass the MCCQ and the NACOSQ, any exams for that matter. You just need to apply from your home country through the BC Health Match. And once you're approved, then you can come, and if everything is done and okay on your documentation, you only sit for this TDM, which is a therapeutic decision-making exam. And then you're ready to work under a supervised physician. But at that time, you're almost working as a full physician, just you're not 100% independent for a defined period, and that person is going to be a sponsor. Once they're done sponsoring you, then you get your full independent license and you're good to go. No residency is needed for this part. The fourth part actually is the provisional or restricted license. And this license, you can get it against just an IMG who has trained in a country that is considered to have an equivalent system to that of Canada. Let's say you train in the UK or you train in New Zealand and Australia. Usually these countries are considered to have an equivalent system or a very similar system to that of Canada. And so you can definitely get a quick equivalence license that you can use to begin to practice. These are usually rare. You need, to actually back you up and be able to say that you will be under their mentorship and under their cover and decide to take responsibility over you while you go through an assessment period. So usually you would then apply to a specific jurisdiction or hospital, get a job offer, and then work under the mentorship or under the tutoring of this particular preceptor who is going to be the person responsible for responding to anything that concerns you. And this happens for a specific period as well. And then once you're done with that specific period, you're free to move on to get your independent license, which is issued by the College of Physicians and Surgeons of that particular jurisdiction. And you're good to go to practice independently. Again, if you need more information, check out our description box. And we're happy if you also hit like and subscribe. It goes a long way to help us. Thank you for doing that. Now, pathway number 5. The fellowship route. The fellowship route is a route which is quite common and known by many people, but very hard to access, and many people don't know how to go about it. I think we're going to talk in a separate video on really how to get a fellowship in Canada. But essentially, you should have specialized in a specific country, whichsoever country that is, before moving to Canada. And you need to reach out to a preceptor or to a certain department who accept that, and you can do your fellowship. So there is some documentations that you need to prepare. Reach out to that program director, talk to them. They will tell you a series of things that you're supposed to do prior. You would also reach out to the College of Physicians and Surgeons. And once you are clear with all of this documentation that they need, then you fly to Canada and you would begin to work in that specialty only and in that specific hospital. You don't go around, or if you have to go around, that will be based on what that specific preceptor or that specific site that welcome you is giving you approval to. So you can come on a fellowship, say Ontario hired you, and then you just leave Ontario and you go to BC and you start working. It doesn't work that way. And you do a fellowship, ideally, usually for about 1 to 3 years, depending on the specialty. Again, if you're doing interventional stuff, usually takes a little longer. If you're doing, stuff doesn't need lots of procedures, or the stuff that is shorter. If you're in a specialty that doesn't need you to do lots of procedures, then this is usually within a year. But again, it varies. A 1 to 3 year is specialty dependent. And after that, sometimes you could get a limited license which after working for a number of years under supervision can then you can proceed to getting a full license. So this is another pathway in which you can become a full independent physician in Canada without sitting for the MCQ1 and the NACOSC exams. All right. Pathway number 6 is the associate physician pathway. The associate physician pathway is you come in when you're still within 3 years of independent practice. Again, you are an IMG or a foreign trained physician. You come into Canada, you meet specific provincial requirements to start working as an associate physician. So you work in a hospital setting, you shadow doctors, you have a weekly supervisor who is going to grade you. You have a probation period that you have to work for, usually 6 months in most provinces. With provinces like BC, I think is 3 months. In Alberta, is 6 months. Before you even get to working, you need to do something we call a pre-screen, where you submit your documents, your essentials, you share your information through your physiciansapply.ca account, which is the official account that any physician in Canada has. And that is true where they communicate. So you have a unique number through this account. And then through that account, you can share information with regulatory bodies. And for you to become an associate physician, usually most provinces will require you to have cleared either the MCQ1 or the NACOSC, at least one of the exams. But there are provinces that are beginning to bypass all of these if you have done specific rotations. I think there's 8 rotations in internal medicine, surgery, pediatrics, obstetric and gynecology, psychiatric, public health. There is a list of them. You can check the link in the description, or you can check on the websites of specific provinces based on where you want to go to. You meet these requirements. And then every province has a certain checklist in terms of how you're supposed to proceed. Again, we know that BC has scrapped away all their exams, and you don't even need any exams. You just need to qualify through BC Health Match, and then you can start working as an associate physician once you get a job offer. In Alberta, it's the same thing. You go through Alberta Health Services, get a pre-screen letter which shows you when your eligibility, because you need to be current. You need, within the last 3 years, you need to practice for a minimum of 2 months in British Columbia, 6 months in Alberta. And I think other provinces have different variations in terms of when you should have been out of practice. You just need to follow that specific provincial requirement, and you'll be hired as an associate physician. The only thing with associate physician is that you would forever remain under the tutorship of a mentor. You would never get independent license directly unless you transition from there and get through the CaRMS to match to then do residency, or as you're working as an associate physician, you do the practice ready assessment to then get your independent license. Pathway number 7, the program is open to people who are willing to move to remote areas in Canada and go as well to the Northern Territories. And usually it's on the basis of a job offer, which you have again to meet some pre-screening requirements, or you have to come from a country that has a direct equivalence to this of training here in Canada, as I mentioned earlier. So the UK, the US, New Zealand, Australia. With these countries, you can get, if you're willing to work in these remote areas, you can get this license and you can go there temporarily and you start working while you regularize your situations to get the same equivalence of your training in the UK or in the US, and then get your full license. So usually these would be for people who have job offer, they meet provincial criteria, and then often they would end up taking the practice ready assessment route or the provisional pathway. But anyways, this way is way faster. It gives you a faster route to independent practice, especially when you're looking at working in underserved communities. They try to fast track your application very quickly. Pathway number 8 would be the academic research appointment pathway, where, IMGs, they are rooted in certain domains or specialties. They come in with that huge expertise that they have. They can quickly get embedded into the healthcare system, especially in the academic setting where they are doing research, and then gradually transition. So usually they will have a robust background of academic credentials and are usually hired specifically by institution because they feel like their value is really great. Usually they are sometimes limited, but if they're really good and they come from a country that is well trusted, then they would not have any issues with licensing. And usually they will come under the tutorship or mentorship of someone. It could be the vice dean, the head of that department, but they are usually restricted in terms of clinical practice. They'll mostly be on the research front, but this will be really research that is clinically driven. So it's clinical information backed. And so you would work with patient most of the time, but you would not have that prescriber authority or authorization. And so you would always need backup, but you can always chip in. You can always see patients and do things that pertain to specific research. And finally, the last pathway would be the military physician pathway. This is a very easy pathway. This is a pathway where a lot of people, if you're physically strong, you have the moral mentality, and you want to work in the military and you like being in the military, this is a very, very lucrative. First of all, they do support you financially. You get to train, you get to be, you do military service for the country. But then you need to also be a permanent resident or a citizen before you are able to join this program. Because if you're not a permanent resident, you're on a temporary work permit, then it's very difficult. You can't join. You need to be a citizen for the most part. Even just being a permanent resident, sometimes you have restrictions to certain areas or to certain posts. You have to be a citizen in order to hold post of responsibility. And you would do military training. You would get credentials. Then you can usually go through the CaRMS pathway, or if you were already a specialist back in your home country, then you can go through the practice ready assessment pathway. But then the military kind of pays for everything to support you and to provide you everything that you need. And this is usually really military specific training, and you get to practice within the military. And if you get to retire and you have your full license, then you can do some private practice as well. But overall, you mostly practice within the military. So in summary, this is really, really the pathways in which you can become a physician in Canada. If you have lots of questions, please don't hesitate, type them down and we'll be able to respond to you. And until then, peace.